This is the inhaled medication administration skill. The first thing we want to do is make sure our patient is being ventilated appropriately. From there, we want to make sure the patient has no allergies to any medications that we could be administering. And also, we want to clearly explain the procedure to our patient. After that, we want to assemble our equipment. The equipment that we'll need for this skill is an oxygen tank, oxygen tubing, a nebulizing unit, our medication, and our personal protective equipment. Now we're going to select the appropriate medication and confirm it with our 5 medication rights. Our 5 medication rights are our right patient, right medication, right dose, right route, and right time. We also want to check for clarity and a good expiration. Now it's time to assemble our nebulizing unit. First step is to put the medication inside of the medication cup. We'll remove the cap and squeeze in. From there, we'll attach the T-piece, our mouthpiece, and our extension tubing. Next is to attach the O2 tubing. This is going to go from the nebulizing unit to the oxygen tank. We're going to now turn on the oxygen tank until we see misting coming from either end. Now it's time to put on the appropriate PPE. For this skill, it's eye protection and gloves. From there, we're going to remove the oxygen mask from our patient and conduct them to firmly hold the nebulizing unit up to their mouth. From there, we will coach them through breathing appropriately until all of the medication is gone. After that, we'll put the oxygen mask back on them and observe them for desired and adverse effects. Now that we've properly demonstrated how to assemble and administer medication via a nebulizer, we're going to show you how to coach a patient to use the nebulizer. Our first step will be to have the patient and assist them with removing the non-rebreather mask. From here, we'll turn the oxygen bottle off, disconnect our non-rebreather, and connect our nebulizer. Now we're going to coach our patient on how to use the nebulizer. Ma'am, go ahead and firmly hold this up to your lips. The mist that you're seeing is the medication that we're administering to you. The goal of this medication is to help you breathe better. What we want you to do is we want you to inhale for 2 seconds and exhale afterwards. By inhaling for that 2 seconds, you're allowing the medication to reach the bottom of your lungs, so we're getting the best results of that medication. Once the medication's gone, we'll go ahead and discontinue the oxygen, take the nebulizer from them, disconnect the nebulizer and reconnect our non-rebreather, and assist our patient in putting the non-rebreather back on. Turn the oxygen back on to the appropriate setting, and we're now going to monitor our patient for our desired and adverse effects of the medication that we administered.